Yeah. Okay, I'm unmuted. Hi, I'm muted. Yeah, 3 minutes. No, so, oh, no, no. What's good? Can you hear me? I want to test. Can you hear me? Can you hear me?
Hi, Elizabeth. Can you speak? You are muffled,
Okay, can you hear me?
loud and clear. So, Elizabeth, once it is the time, we're not waiting for anybody. We just start. The goal is to finish 8 on the dot. Even though it looks like 15 people, let's just start. Who is
Okay,
Uncle
ma'am.
Paditek? Is that Aminat?
Yes, I'm in that.
Elizabeth, your background is plain. There's nothing decorative we can. There's nothing. Let's see. So I'm sharing this. So I'm the one sharing slideshow. We have 4 more minutes. So when are we going to take it off practice session?
When's this a minute? Or
I,
should we
I,
take it now?
I think you can take it off now. There's no
Okay.
wait.
So we should take it off now.
And Liz, once you take it off, you welcome everybody. Welcome to the Prevent Cancer Masterclass. We're starting in 2 minutes.
Good evening, everyone. Welcome to Prevent Cancer Masterclass 5.0. We'll be starting in 2 minutes. Please stay tuned. Good evening, everyone. Welcome to Prevent Masterclass 5.0. My name is Elizabeth Abodrin, and I'm the Clinical Research Associate at Oncopady Technologies. In celebrating World Cancer Day today, Oncopady Technologies, Pearl Oncology Specialist, Hospital, Shebeki Cancer Care, and Cancer on the Street has come together to present this free masterclass in Prevent Cancer. Today, we'll be achieving these two goals, and most importantly, we'll be having 30 minutes with our speaker, Dr. Omolara Salako. She'll be taking us on cancer prevention. She'll be bringing in years of experience and expertise from clinicals and research. And 20 minutes, we'll have an interactive question and answer session. For housekeeping rules, would like to let you know that cameras and microphones are automatically disabled, and the chat is only for introduction, and you can kindly introduce yourself, let us know who you are and where you are watching from today. The question and answer box is mainly for asking questions, so you can start dropping in your questions when the speaker is speaking or after she's speaking. And today's webinar is recorded, and you can always go back to check in on Pearl Oncology's YouTube channel. I would be introducing our speaker, Dr. Omolola Salako. She is one of 100 clinical radiation oncologists in Nigeria with over 20 years of experience, and she's a senior lecturer at the College of Medicine, University of Lagos. She's an author, and one of her books, Gift of Survivorship. She's also a podcaster, Cancer on the Street. Can always watch on YouTube. She has supervised cancer screenings with over 35,000 women and treated over 5,000 patients. She serves on multiple national and global oncology task force and boards, and she has organized over 500 corporate wellness programs. So I want you all to please welcome Dr. Mola Salako, popularly known as the People's Oncologist. Thank you.
Thank you very much, Elizabeth. It's a pleasure to be here. My team and I have been planning this for so long, and it's finally a pleasure to deliver this masterclass. And as Elizabeth said, in 30 minutes, I'll quickly run through a whole lot based on research, based on experience. And it's important we do sessions like this because from where I sit, thousands of Nigerians are being diagnosed with cancers and they don't have business with these cancers. Unfortunately, because they don't know this, they eventually develop cancer. So I'm hoping that the knowledge you gain in this session, you will be kind enough to share it with people that you know, people that you love. But most importantly, it starts with self-love. It starts with yourself, that you would begin to apply them. I'd like you to have a note, a pen, or your device handy, because the idea is, from what I would share, I want a situation where you have your own personal to-do list. That's how we're going to make this interception roadmap work for you. Today is World Cancer Day, and it's hosted by an international organization called the Union International for Cancer Control. And everybody active in the cancer space is talking about cancer. For a country like ours in Nigeria, where our healthcare system is budding, it's getting stronger, it has its challenges, but still we are striving through. It only makes sense that we invest in prevention. So my goal is very simple today. I want to simplify cancer prevention. It should not be mysterious. It should not be a myth. It should not be an impossibility. So you may know some of the things I'll share with you, but what I really want you to do is to begin to apply them. Now, this masterclass is for you. And there are 5 categories of people I want this session to benefit the most. The first are those people who have a high risk of developing cancer. Some people have an average risk, some people have a high risk. An average risk is, there's nothing to be worried about. The fact that the person is getting older, that's what we refer to as, everyone has an average risk of developing cancer. But people with a higher risk are people who have a family history, like 3, 4 people have cancer in the family. The second group of people are those who have a health condition like diabetes, hypertension, or obesity. Now, these conditions actually create similar pathways to how cancer develops, and sometimes they share similar pathways in how the different diseases progress. So if you're diabetic, hypertensive, I'm not saying you're going to have cancer. I'm just saying there's some common risk factors across those disease groups. The third people that will benefit from this session are people who are experiencing immunosuppression. For example, people having kidney transplant or are on certain medication because we have to reduce or suppress their immunity for genuine medical reasons. And the others who have infections like HIV, which naturally, as a virus, suppresses the person's immunity. Now, this is a category of people, because their immunity is suppressed, they have a higher risk of developing cancer. And the fourth people are those who want to stay ahead of the curve, who want to stay healthy, who want cutting edge information, and they are enthusiastic about good health, aging properly, living a long, healthy life. And the fifth are the gatekeepers. Many of us are leaders in our organizations, our religious institutions. We gatekeep people, and just by word of mouth, we're able to share important information with people around us. So this session is for you, and that is why you should have your note or a device where you take important points. I would love you to be an ambassador of the Prevent Cancer Masterclass, where on your social media profile, on your platforms, you share 5 to 10 tips you learned in this masterclass with your own network. Now, before I jump into how to prevent cancer, I want to explain what cancer is. A lot of times people mistake cancer as a disease that is far away, that starts from one part of somewhere. You know, people don't associate cancer with the fact that everybody produces a cancer cell. Almost everybody produces a cancer cell. What is a cancer cell? A cancer cell is a cell that has a mistake, has an error caused by different reasons. And this cell has this abnormality that makes it divide so fast. Most times, when a cancer cell is created in the body by error, the immune system will kick in immediately and delete it. But the problem we have with cancer is that it divides fast. It knows how to transfer itself and attach itself on things nearby. But more importantly, it knows how to hide from the immune system, the very system that defends the body and eliminates it. So when I say a lot of people produce cancer cells, the reason why it doesn't grow or manifest or spread is because what I want to share with you is your immunity is critical. And there are many things we do that affect our immunity as the session goes on. As you may know, cancer is so common, so common, arise from many parts of the body: the blood cells, the skin, gallbladder, lungs, pancreas, breast. But there are 3 places till date cancer has not been recorded. And I remember when I started my training a few decades ago, my professor would, that was one of the first questions he asked. He said, where are the most common cancers? And it was easy to say, there's breast cancer, cervical cancer, this cancer. And then he said, where are the places cancer has not occurred? I'm not going to take you on an exam. I'll tell you very quickly. Till date, we have not documented cancer of the hair, cancer of the nails, or cancer of the teeth. But every other place, every other part, every other cell in the human body, cancer has been documented to occur. In 2022, our data showed that 127,000 new cancer cases occurred in Nigeria. That is a whole lot of Nigerians, our mothers, our fathers, our sisters, brothers, different people. Christians, Muslims, rich people, low middle income people, smokers, non-smokers, fat people. It affected hundreds of thousands of people. But what I want to draw out of that is that of the 127,000 cases that occurred in 2022, and I'm translating this to last year, at least 48,000 were preventable. And so when I sit in the clinic and I'm taking care of cancer patients, I have a silent regret when I see that this cancer could have been prevented if the patient went for a checkup or knew that a particular habit should have stopped. And so last year I was involved in taking care, managing about 1,000 cancer patients directly in my clinic, and indirectly I collaborate with other medical teams to take care of cancer patients. Again, in clinical practice, as of last year, I could look through the records and I saw that about 300 cases were preventable. I want to share some pearls of wisdom, why some cancers are preventable. The first one is cancer is not new. Even though it's getting commoner, it's changing, cancer has been in existence for decades, thousands of years. One of the principles or one of the concepts my professor back then used to say was, in the Bible, the woman with the issue of blood, he used to say that he thought she had cervical cancer because the symptoms of cervical cancer is abnormal vaginal bleeding. When a woman bleeds, for example, after sex, bleeds after menopause, or bleeds in between period. And the woman with the issue of blood was bleeding. And we used to, tell him back that it probably was fibroid, and there are other genuine reasons why a woman may bleed that is not related to cancer. But what I'm trying to pull out is cancer is so old that we have studied it so well, and we know and have data that helps us identify the risk factors that can cause cancer. With this knowledge, we are able to tell the public how to reduce their risk. So cancer prevention is first with knowledge, second with application, and it is backed by evidence. The second principle I want to share with you is that some cancers are kind. And I know this is controversial because people are like, cancer is terrible. But I just want you to be open-minded about this. There are some patients that come to the clinic and they're feeling fine, they have one condition or the other, they have no symptom. Maybe they're hypertensive and they're being managed for a certain condition for hypertension. But all of a sudden, they develop another symptom and they scan and they see a mass there. But that mass has been there for decades, hidden, no symptom. There are some cancers that are preventable. They give us signs 30 years before, 20 years before, 10 years before. They are kind enough to start off as something innocent, like a rash. If we intervene, we will take care of the rash or the tiny boil. We call it precancer. So some cancers are kind enough to have stage 0 or have a precancer stage. And examples of this type of cancers are cervical cancer, colorectal cancer, liver cancers. There's a second group of cancers that they don't give any early warning signs. In fact, there's no screening test available for them. And they would occur, but if you go check in, you will pick it up very early, maybe at stage 1. And this is quite different to the first group of cancers where you can pick it up at stage 0. Now, for this second group of cancers that usually present at stage 1, they vary. Some breast cancers can present at stage 0, and that's why we encourage women to do their mammograms, their clinical breast examination, and so on and so forth. But there are also some cancers that till date, we don't have screening tests that can pick them at stage 0. But we can pick them at stage 1, stage 2, which are early and have a high potential for cure. Then the third group of cancers are, we can't even pick them early because when they occur, they don't cause symptoms, they don't show up on tests until they have caused a lot of harm or damage. Until date, we sometimes don't even have the best treatment for it. I want you to appreciate the fact that science has advanced in many areas. We can prevent certain cancers, but still we are unable to prevent certain cancers, but we can detect some of them early. And in the third group, we can't detect them early, but we can treat, and science will continue to advance so that eventually we can prevent all the cancers, just as smallpox was eliminated. Lastly, on this pearls of wisdom, the last principle I will share about prevention is when we talk about prevention, primary prevention and secondary prevention are two concepts I want you to appreciate. Primary prevention is when we stop the disease from starting, meaning there is no exposure to the causative agent. For example, tobacco causes lung cancer. If someone doesn't smoke, they wouldn't develop lung cancer. Secondary prevention is this person has been smoking for, let's say, 5 years or 10 years, then stop smoking because they want to live longer and live healthy and reduce their cancer risk. And because they stop smoking, they begin to reduce their cancer risk. And so secondary prevention is the same as interception. It stops the changes that the tobacco would cause in the lungs. So there's primary prevention, don't get exposed to what can cause cancer. While secondary prevention is, the person is already exposed, but withdraws from that exposure so that they reduce their risk. At Pearl Oncology Specialist Hospital, we know there's wisdom in cancer prevention because it costs millions of naira to treat cancer and it costs less to prevent cancer. Our goal this year in 2026 is to help 5,000 people prevent cancer through education and screening. And that's why we've organized this masterclass. And I want to thank you all for joining us, for spending 1 hour with us to learn how to prevent cancer. I also want you to be an advocate. Please remember that this information should start with you. Be your own self-advocate to learn what you can do to improve your health, and then spread the word. It is important you don't become a statistic, so you don't become part of these numbers. It is predicted that by 2030, 1 million Africans will die from cancer. It is wise for us to not be part of that statistics. What God has blessed us with, which is knowledge and nature, we must be disciplined to follow the wisdom and not become a statistic. Secondly, I don't want you to be my patient because the workload is much. We do have 100 oncologists in Nigeria and we are not enough. It will be great for us to prevent the cancers that should not come into our clinics so that we can focus on the cancers that we can't prevent and focus on curing such cancers. But most importantly, the essence of living is to live well, is to age better, and is to have a great quality of life. And that's why the Prevent Cancer Academy education session is critical. Another thing we've introduced at Pearl Oncology Specialist Hospital is a dedicated clinic for cancer prevention. If you fall into any of the 5 categories I mentioned earlier, maybe you're HIV positive, you have a chronic condition like diabetes, you're immunosuppressed, or you have concerns and you want a one-on-one consultation, please visit our clinic and my team will share the booking link to booking a consultation. Our clinic is located at 24 Ifuru Zimora in Lekki. So the question I always ask myself, and sometimes I ask my patients, why are we not preventing cancer? Is it that the information is not out there? And in summary, there are many reasons. Some are genuine, some are just what it is. The first is some people just don't know that cancer is preventable. They are unaware and they don't understand the benefits of cancer prevention. The second group of people have an idea that they should do their annual medical checkup, they should not smoke, they should not do this, they should not do that. But they choose to ignore it because maybe lack of discipline, maybe for pleasure reasons, maybe for procrastination. And then there are a group of people, for financial reasons, they can't afford their screening, or many people do have health insurance and do not even use their health insurance plans until the end of the year, and they go into do eye checkup, dental checkup. What we want you to do, the habit I want you to have, is to have your annual medical checkup inclusive of cancer screening. And I'll share some of our plans with you today. At the end of this session, I have 3 promises for you. The first is you'll be very clear on how to identify your specific risk factors, things within the environment. In Nigeria, it may even be in your home, it may be at work, that may increase your risk, your lifestyle, and other factors that may increase your risk. I'm going to also share a screening strategy, which we have provided at Pearl, and we have several plans that I would like you to choose from. And the third promise is, because we see that many people are worried, scared, we've created a system that will support you. If you purchase the screening plan, you'll have a dedicated case manager that will handhold you, support you, explain things to you, and be there for you from the first day to the last day of your screening plan. But most importantly, you will have a one-on-one consultation with our medical team comprising of specialist medical officers. You will have a dedicated manager. You have a dietitian who will provide cancer-fighting foods that would help you live longer. And here are 3 of our plans. The first plan is the silver plan, which costs 159,000 naira. It is for adults above 25 years old, comes with a dedicated manager, someone who would handle you for 2 weeks. There's a community. You will be welcome and onboarded into the community. You'll have a consultation with our medical team, and we would run several tests, more than 14 tests, more than 60 parameters, and these are the tests we are going to These are the parameters we're going to check for. The second plan is the platinum plan, which is 400,000 naira. It includes everything in the silver plan, but it has extra perks. You have a consultation with an oncologist, with a dietitian. There are more tests, there are more parameters. And the third plan is the pearl plan. This is inclusive of the platinum plan. It has super perks, more benefits, more consultations, more tests. It's more personalized. And these are the three screening. If you'd like to book a screening plan, the links will be in the comment section. Go ahead. We are not just sharing science. We're going to support you, and you'll have a case manager assigned to you. You'll have a seamless experience with us at Pearl Oncology. You'll receive your full medical reports within 72 hours, and you can choose from any of our plans. I would love to talk to you about inflammation. I've touched a bit on different things that can increase the risk of cancer. But the foundation of cancer is inflammation. The good thing about inflammation is it's our body's natural way of responding to infections, injury, and foreign objects in our body. So we can't live without inflammation. It is part of our immune system. If someone has a cold or has diarrhea, whatever the new thing is in their system, whether it's a germ or an injury, they definitely will have an inflammatory response. Most of us have had either malaria or one condition or the other, a boil in the eye or in the armpit. You'll notice that with boils, they are painful, they are red, hot. That is the typical way inflammation works. But why this is important in the development of cancer is if inflammation stays for a long period of time. Remember, inflammation is a life-saving immune response to infection, injury, and foreign invaders. Inflammation will remove all these things, and once the invaders are gone or the infection is eliminated and treated, then the inflammation should relax and calm down. The way inflammation works, and I would like to highlight two pathways out of the many pathways, is imagine someone has a cut or you touch a door handle, you pick up a germ, then you touch your nose, or you eat food that is contaminated with bacteria. The minute your immune system picks it up that there's bacteria in the body, it will put a lot of white blood cells and send it to that bacteria. And what the white blood cells will do, it would surround the bacteria, swallow it up, and poof, inflammation works. It recognizes there's a foreign body, an abnormal cell like a cancer cell. It creates chemicals and sends it to the invader and sort of dissolves it and lyses it. This is how inflammation works. It is an acute thing, it is a now thing, and it will keep working until it eliminates the germs, the bacteria, or the abnormal cell. So I just want you to have that at the back of your mind. If you have any questions at all, please drop your questions in the Q&A box. Because I'll be rounding up soon and I would love to take your questions. So very quickly, I'm going to touch on how inflammation thrives when there are certain conditions, certain scenarios promote inflammation. And I'm going to share 12 of them. So the first is an unhealthy diet. That's a diet rich in sugar, fat, oil. An unbalanced diet promotes inflammation. So if you want to hack cancer, you want to have a balanced diet. You want to eat more plants because in your intestines, there's bacteria, a lot of bacteria. In fact, 1 trillion bacteria. When you eat food that promotes the good bacteria, processed food, then the bad bacteria flares up and promotes inflammation. Another way you can hack cancer is to maintain a healthy weight. The bigger you are, the more fat that you have. It's like it's sizzling. The fat is converting. When you look at fat, it may look very flexible and soft, but chemical reactions are constantly happening in fat cells. It is either the fat cells are converting to hormones or they are converting to energy. They are promoting the production of insulin and all types of things. They're promoting the production of glucose. Chemical reactions happen a lot in fat cells. And as long as those fat cells are present, it means for a long time, these chemical reactions will continue to happen. And they work on inflammatory processes. The third way you can hack cancer is to exercise regularly. Good blood flow triggers your immune system, reduces inflammation. There are several pathways in which exercise reduces inflammation and improves your immunity. But the most important of it is the way blood flows through your system, the way your circulatory system from your head to toe during exercise pumps up, the way good hormones jump up and the way the bad hormones are reduced. All of that calms inflammation. So if you want to put your body in a stable state, in a better state, it's important you exercise regularly. 30 minutes a day, short walks, brisk walks, whatever works for you, you need to see an expert to design an exercise plan. I must thank you all because I have over 200 participants on the call. I'm really grateful. From all of us at Pearl, we are sending you our love. Thank you so much for turning up. We're excited. Today has been worth it, and the hard work has been worth it. Thank you so much. I just had to acknowledge everyone's presence here. Sunshine is a blessing. It's a source of vitamin D. But these days, because of climate change, there are certain layers of the sun we're exposed to that isn't as friendly as it should be, especially for light-skinned people, albinos who have lower melanin. It is important you reduce your exposure in the sun and you use sun protection factor. This is not about, it's not beauty regimen or beauty therapy anymore to use sun protection factor. In clinic, we see skin cancers. There are 3 types: squamous cell carcinoma, basal cell carcinoma, melanomas. And what we notice is these cancers, especially in light-skinned people and albinos, tend to appear in areas where their sunburns, areas where the skin is exposed to the sun the most. You need to limit alcohol. If you're taking alcohol, you need to limit it. And this is different to the 5th point, which is completely avoid tobacco. We don't want you smoking tobacco. You need to protect yourself against infections because there are some viruses and bacteria that that lead to the progression of cancer. There are certain chemicals we're exposed to, and I will just run through this quickly. I want you to get vaccinated. I want you to know the screening useful to you. You need to know your family history because in clinic, every time you go to the hospital, the doctors will ask you a battery of questions, and we tend to focus on family history because we know for some people there are certain patterns. Many of us know the popular story of Angelina Jolie, the Hollywood actress who has an abnormal BRCA gene, and this is the gene for breast cancer. In her family, 8 people had been diagnosed with cancer: breast, ovarian cancer, and some other cancers. And most of them were on one side of her family. Now, for somebody like that who has a strong family history, she's at high risk of developing cancer. There are certain steps she's going to take that will reduce her risk. And that's exactly what she did. Now, back to inflammation. The inflammation that causes cancer, that promotes cancer, let me take that back, not that causes cancer. The inflammation that promotes cancer, that isn't good for the body, is the one that is chronic. It's the one that is there for a long time. It causes problems because it causes this slow damage to the body. And there are many bad lifestyle choices, infections, injuries that cause chronic inflammation. Acute inflammation is the good kind. It defends our body. But when inflammation persists for various reasons, then it can trigger cancers. Now, what are the common reasons or common triggers of chronic inflammation? Nigeria has a high incidence of hepatitis B and C infections. And many people are walking about not knowing they have contracted hepatitis B and C. In fact, we diagnose liver cancers first, then find out the patient is hepatitis B, C positive. And that's the first time the patient is finding out because they've never done an annual medical checkup. We diagnose cervical cancer, and the woman has not done a pap smear in the past. So there's a poor attitude to medical checkups. Now, when someone has a viral infection, viruses are powerful. They have the ability to force their way into cells and change the command. They are rebellious. They terrorize the cells, they cause problems, and they make sure the immune system doesn't detect them. In so doing, they begin to change a normal cell to an abnormal cell. In so doing, these viruses are able to make this abnormal cell hide from the immunity. And when a cell is abnormal, it's going to produce more abnormal cells and more abnormal things. It is the combination of all these abnormal things over a long period of time that then forms into cancer. So untreated infections promote inflammation, immunosuppression, chronic diseases, smoking, obesity, chronic stress. Many people live a very stressful life. They don't sleep well enough. As adults, we should sleep for at least 7 hours a day. Now, other issues I want to highlight to you that promote chronic inflammation is sometimes foreign bodies are placed in a person's body or are inhaled. In certain parts of Nigeria, there's black soot. And black soot is because they are refining oil. There's this black smoke clouding areas like Port Harcourt. Children, adults are inhaling the soot. And recently in clinic, I met a gentleman. I asked, can I see a picture? He showed the first picture. I asked for another picture. He showed the second picture. And I scratched my head. I said, what is this? So I went back to the beginning and I said, where do you currently live? He said, lives in Lagos. And I said, let's track back to your childhood days. Where have you lived? And then it came out that he lived in Port Harcourt. And he alluded to the fact that he had inhaled a lot of black soot because the soot just covers the entire air. Now, what does soot contain? It contains chemicals, it contains heavy metals that the body cannot degrade. The white blood cells cannot remove it. The chemicals cannot dissolve it. So they are there permanently. What do you think smoke will do to a body? It will slowly burn it, slowly irritate it, and then form changes that can lead to cancer. Another cause of inflammation is when there's an imbalance in the gut. And the last point on this is really around chemicals. Some people are unfortunately burnt by chemicals, either at work or through accident, and this causes damage. So when people are burnt, the way they heal can be with some errors, and such errors can lead to cancer. Another point I want to touch on is something that is so common in Nigeria, metabolic syndrome. Metabolic syndrome is so common that it's said about 20% of Nigerians have metabolic syndrome. I want you to know that metabolic syndrome creates inflammation in the system. And it is defined as having at least 3 of these 5 risk factors or issues. First of all, having a pot belly is one risk factor. The second one is when we do a blood test, we check the fat level. If it is high, that's a second risk factor. The third is when the cholesterol level, a particular type, low LDL is low. And the fourth is when there's high blood pressure. And the fifth is when the blood sugar is high. So out of these 5 parameters, if someone has 3 of this, we say they have metabolic syndrome. It is not a common name, it is not a common condition, but it is something my colleagues and I have researched for over a decade amongst breast cancer patients. And we're beginning to see for the first time that metabolic syndrome is actually driving some cancers in Nigeria and is making some aggressive cancer to be more aggressive. And so in the prevention perspective, we want people who have metabolic syndrome to manage this properly by seeing the right doctors. I've talked a lot about chronic inflammation, so I want to share how we measure it and how we take note of it. Of course, there are tests that we do to measure chronic inflammation. Some of it include high sensitivity C-reactive protein, ESR, and some cytokine panels, all of which are included in the screening plans available at Pearl Oncology. The second is when you see a doctor at our facility, we will do a symptom audit and we will ask questions around, are you tired? Are you forgetful? Do you feel your head is crowded, is cloudy? Do you have digestive issues? Some people are eating late, are eating too much processed food, and they are causing a lot of inflammation in their intestines. And immediately, this is something I want you to take note of. Cut out late night eating, cut out the processed food, cut out sugar, reduce them, add more plants. But most importantly, you should book a consultation with a registered dietitian here at Pearl. And the third is chronic inflammation is not something that is written on the forehead. Neither is it a diagnosis that is clear to make. But based on a full clinical assessment, laboratory works, and the questions and assessments we would do, we tend to identify a diagnosis. But usually our patients will say, yes, I am mentally stressed, like I feel frigid, and my body feels sluggish. And people say, I feel stressed. It may also be a sign of chronic inflammation. All of these things I have talked about are things you can change with your lifestyle, your diet, your sleep pattern, how you manage your stress levels. I have a quick question for you. Who's responsible for cancer prevention? Is it the government or is it you? Or both? I would like you to answer that question very quickly in 30 seconds. And we have it as a poll. Who's responsible for cancer prevention? Is it the government? Is it you? Emel Okon says both. Welcome, Dr. Okon. It's great to have you here. Bukola from Atlanta, Georgia. Welcome. Thank you, Dietitian Ajayi from Ekiti State. Thank you for your questions. I see them coming, and I'm wrapping up in 5 minutes so we can have enough time for Q&A. Excellent. So our first poll result is out. I love it. I love it. Thank you. Most of us agree that it is up to us. It is our choices that we are responsible for cancer prevention. I am responsible for reducing my own risk of cancer. So are you. Yes, our government plays a role by creating policies, making cancer screening available in our primary healthcare centers and general hospitals, making vaccination available, and that consistent encouragement for more people to take advantage of what is available in our government hospitals. And I want you to know that up until last year, we had free vaccination programs available for young girls against HPV. I believe it's still available. Please go to your nearest primary healthcare center, general hospital. If you have a private hospital, visit and ask this question. What cancer prevention services and annual medical checkup do you have? And take advantage of it. You also have the option to join us here at Pearl Oncology Specialist Hospital, where we will take care of you. I remember a conversation I had with a lady, and I was telling her that cancer screening is important. In that same conversation, she gave me like 7 reasons why it wasn't important. She was like, I'm busy. I don't have time to go and be looking for what is not lost. Okay, I don't even know where to go. Tell me where to go. Okay, what tests should I do? And the approach towards her own body was not appropriate. And so I just want to share that healthcare professionals, government, and stakeholders will do what they can. But there's also that vacuum where people are not showing up. I'm not here to accuse anyone, but people are not showing up for their health. Many women, when they come down with cervical cancer, they will spend nothing less than 3 million naira. But how much is pap smear? It's less than 30,000 naira. How much is vaccination? It's less than 50,000 naira. And it's even cheaper in many parts of the country. So I need us to be wise. I need us to apply wisdom to our health because we have only one body. And we can prevent cancer and we must prevent cancer. I've talked about inflammation, how poor diet, ultra-processed foods promote inflammation. What I want to add is for your diet to be balanced, we encourage you have but I want you to take note that you should have a colorful plate. You should have at least 3 natural colors. What does a balanced diet look like? Many of us like rice. Rice, vegetable, and meat. Rice is carbohydrate. Vegetable is high in fiber, has a lot of vitamins, and then protein is protein. Sugar, reduce it. Sugar actually is a source of inflammation because it is refined, it is processed, and it goes through this chemical process that makes it unhealthy and it triggers inflammation. You want to reduce your sugar intake and you want to replace it with honey. People say, oh, honey is also sweet. It is true, but the content of honey is not the same as refined sugar. Honey is natural because it is produced by bees. But the advantage of honey is it is a prebiotic. It is something when taken, it makes the good bacteria in your intestines happy. And that is the type of food or substance you want to take. Touching quickly on healthy weight, you need to know your BMI. So let's say you're 30 years old and you weigh 70 kg and your height is maybe 150 cm. There's a way medical professionals calculate your BMI according to your height, your weight, and it should fall within this 4 category. Are you underweight? Do you have a healthy weight? Are you overweight or are you obese? And so when you come in for your medical checkup, these are the things we will check and a plan would be tailored. The higher your BMI, the higher the risk of developing cancer. In Nigeria, are we seeing obese people with cancers? Yes. The common cancers we're seeing are breast, prostate, and endometrial cancers. We've talked about sun exposure. which is a risk factor, especially in albinos. We want you to use umbrellas when you go out, wear your clothes and cover your skin, use sun protection factor. Sedentary lifestyle. For many people who work corporate, please, it is important you are conscious to move about. What is important is the more you sit, the less your body does. The more you sit, the less blood flow. Your muscle is a machine. There's something about your muscles. When it is active, it produces chemicals that reduce inflammation. So when you are exercising, the hormones and chemicals being produced makes your body healthier. So we want to encourage you to a situation where you are seated most time habit. You may decide every 1 hour you stand, you jog on the spot, or you take a short walk and then you come back. Tobacco is a no-no. Tobacco contains more than 3,000 chemicals, 7,000 chemicals that are known to cause cancer. Tobacco, when smoked through the mouth or inhaled as snuff, actually damages the lining from the mouth into the intestines, into the respiratory system. When this damage occurs, it occurs frequently that if when this damage occurs, because the damage occurs frequently and the repair occurs frequently, there's a chance for an error to occur. Tobacco also suppresses the immune system. And tobacco is hot, filled with chemicals. It produces inflammation. So tobacco is an immunosuppressant. It is addictive. It injures the body. It burns it off slowly. It causes inflammation, and it makes it ripe for many people to develop cancer. I must point out that some people develop cancer without smoking, while some people who smoke don't develop cancer. Besides lung cancer, people who smoke are prone to mouth and throat cancers, kidney cancers, esophageal cancers, and other types of cancers. Lastly, I want to talk about the screening guidelines for women and men. If you're in your 20s as a woman, you should start your cervical cancer screening with your pap smear, with liquid-based cytology, and HPV DNA. If you're a man, testicular self-exam. You can present to the doctor and the doctor will check for that. And this list is really around cancer screening. I'm not talking of the annual full medical checkup, which is important, and cancer screening is a part of it. In your 30s, we go further and we do the cervical cancer screening, inclusive of the clinical breast exam for women in their 30s. And that's where a doctor checks a woman's breast. Same thing for men in their 30s, they go on to do the testicular self-exam. As from 40s, we up the screening for breast cancer in women. We include the mammogram. We encourage some women to do the breast scan. We continue with the cervical screening. And for men, we introduce prostate cancer screening. And that includes the prostate-specific antigen test, a rectal exam, and that's when the doctor checks the prostate through the anus and we do scans. In 50s, it's almost the same thing for women. Breast cancer screening, cervical screening continues. Then we introduce colorectal cancer screening. For Nigerians, we've reduced the age from 50s to 45 because certain cancers in people of African descent, it occurs at a younger age. So we introduce colonoscopy and other stool tests at 45 for Nigerians. And same thing applies for men. We continue with prostate screening in their 50s, colorectal screening, and lung cancer screening in smokers. So we don't do lung cancer screening for people who don't smoke. We do it for people with a high risk of developing cancer. Then in 60s, it's almost the same thing: breast cancer screening, colorectal screening, lung cancer screening, and we check on the bone health for women because now they're approaching menopause and the bones may not be as healthy. Same thing for men, prostate cancer, colorectal, lung cancer. And it's almost the same thing for 70s. In the age range of 70s, we begin to wind down on the screening. And especially if the screening results are normal in the last screening checks. Just to remind you that we have 3 screening plans: Silver Plan, Platinum Plan, and the Pearl Plan. You can book a consultation with us here at Pearl Oncology Specialist Hospital, and you can purchase your screening plans right away. I like to end with the serenity prayer. God grant me the serenity to accept the things I cannot change, the courage to change the things that I can, and the wisdom to know the difference. Thank you for listening. We will go into the Q&A session, and I'll hand over to my moderator, Elizabeth.
Thank you so much, Dr. Salako, the People's Oncologist. That was a really thought-provoking session. I appreciate all you have said today and taking your time. I also appreciate all the audiences. Thank you for taking your time. Thank you for participating. And I also implore you to please go back to Pearl Oncology's YouTube page to rewatch this session. You would still learn new things. So going to the questions, thank you. A lot of you have already written down your questions. We have about 17 questions here. You can still drop your questions in the Q&A. So I'll be going to the first question now. Does a prolonged infection like throat infection leads to cancer? Also, does prolonged ulcer not treated lead to cancer?
So with throat infections, there are different types of infections. It may be a viral, it may be a bacterial infection. Throat infection usually wouldn't lead to cancer. It wouldn't. I don't think it would. But the catchword there is prolonged. When something is persistent, it should be checked because one of the issues we have in the cancer space is when our patients present to us, they say, I've been having this thing for a long time. I've gone to 2 or 3 types of doctors and they said, treat it like this, treat it like that. So I would like to encourage you to see a specialist. And the specialist for throat area are the ENT, ear, nose, and throat. Please see an ENT specialist to cross-check what is causing that repeated infection and sort of identify what is, why is it happening? You must be exposed to something that is, making it, that pattern is not good. It has to be stopped. So you need to look at it from your environment as well as see a specialist to identify why that is happening. And it should be treated and taken care of. It's not natural for an infection to persist.
Thank you very much, Ma. The next question, what is the best suggestive treatment for rhabdomyosarcoma after 8 courses of chemotherapy?
Please say that again.
What is the best suggestive treatment for rhabdomyosarcoma after 8 courses of chemotherapy?
Okay. I'll answer that question. So, rhabdomyosarcoma is a soft tissue cancer. The gold standard for treatment is surgery, if it is possible. If surgery is difficult, then it's usually chemotherapy. There are some target therapies that may be considered, but chemotherapy is very important. I would encourage that person to ask their oncologist this question because it depends on response. When we treat with chemotherapy, we're expecting the cancer to either disappear or get smaller or it stays the same size. So there's a lot of assessment that needs to be done to answer that question. But I think that's a good question for the oncologist. And with rhabdomyosarcoma, it's the oncologist and the orthopedic surgeon, someone who's good at a surgical specialist who's good at treating soft tissue cancers. And usually they're the orthopedic surgeon here in Nigeria.
Thank you, Ma. Can kissing cause any form of cancer?
Can
Can kissing cause cancer?
I'm sorry, I didn't hear you. Can what?
Can kissing
Kissing. Oh,
can
no,
kissing
it
cause
can't cause
cancer?
cancer. It can't cause cancer.
And is cancer transferable?
No, it's
If
not. It's
yes,
not transferable. It's not transferable. It's
okay.
not
Does
contagious. It's not an infection. You can hug someone who's diagnosed with cancer. It's not contagious.
Thank you for clarifying, Ma. Does a ketogenic diet improve or prevent the risk of cancer? A ketogenic diet.
Okay, so there are many types of diet, and I like to leave that type of question to the registered dietitian because when you come in for when you see a registered dietitian, there are many things they will assess: your height, your weight. They will calculate your calories. As adults, many of us need, I think, about 2,500 calories a day. Some people are eating 5,000 calories. Some people are eating 1,000 calories. So the dietitian is going to identify where you fall into and then recommend a balanced diet. The challenge with some diets is that they focus on one type or two types of food. And we are saying we want you to have a balanced diet that contains 5 types of food. So I want to shy away from promoting a particular diet because it is such a personalized decision. Next question, please. To colorectal
Okay.
cancer.
Can H. pylori be a precursor to colorectal cancer? How long can one be in remission after low reduced CEA after chemo? Should I take it again?
Yes,
Okay.
please.
Can H. pylori be a precursor to colorectal cancer? How long can one be in remission after low reduced CEA after chemo?
Okay, so this is a two-in-one question. Can
Yeah.
chronic H. pylori be a precursor to colorectal cancer? So H. pylori is a bacteria that is known to cause ulcers like peptic ulcer, which can be in the stomach. If not properly treated, it can be a precursor to stomach cancers, esophageal cancers, rarely colorectal cancers. The second question is how long can one be in remission after low reduced CEA after chemo? For a very long time. It depends on the stage at which treatment started. If someone is a stage 1 at the beginning of treatment, they have a higher chance of attaining remission and cure compared to someone who was diagnosed as stage 3 and has the same type of treatment. So remission and cure is higher, much better for early cut diseases. And that's why colonoscopies are important for anyone on this call who is above 45 years old. Before colorectal cancer develops, it develops as a tiny boil. And that tiny boil takes 10, 20, 30 years before it becomes a big pimple. And so colonoscopies is a procedure where a tiny wire with a video is passed through the mouth or through the anus to look at the intestines. Now in Nigeria, we have the type that the colonoscopy is a tablet and it can be swallowed with, with a drink. And it has a video embedded and pictures are taken as as the video is going down. So colonoscopies are very important in identifying super early stages of colorectal cancer. Elizabeth.
Yes. So, what do you think about medicine in curing cancer, especially soursop? I would like to take this other question because they are related. For elderly people, can supplements help against cancer? What do you think about medicine in curing cancer, especially soursop? And for elderly people, can supplements?
Okay, so soursop is a good fruit. It is known to have a lot of antioxidants. So the reason why we promote fruits and vegetables is the fact that they have antioxidants and they are high in fiber. And these are, are good stuff within the food that actually bring down the inflammatory levels. When there's inflammation, because it's a chemical reaction, sort of, antioxidants sort of remove the chemicals produced by inflammation. So soursop is good. Supplements are man-made vitamins and antioxidants, which can be found naturally in a balanced diet. But some people need to be placed on supplements for specific reasons. For example, there's some people when you do their blood test, their potassium may be low. What would we recommend? Eat 3 fingers of banana. Well, we can also prescribe tablets. So I just want you to know that your diet can be powered to power your body better and to serve as supplement. But if you must go on supplements, I encourage you talk to your doctor. But of course, there are also some over-the-counter supplements that you can use on a daily basis, such as vitamin C and things like that. But again, you can find vitamin C in oranges and many other fruits.
Thank you, ma. Can diagnosed cancer be managed so it does not progress?
Can diagnosed cancer be managed? Yes, it can. It can. As I said earlier, we can detect some cancers early, we can treat them effectively. You need to be treated. For those on the call who are living with cancer, it's important you are managed by a specialist team. Even if you're in a state or a hospital that doesn't have an oncologist, it's important you find out if your surgeon or other doctors are involving an oncologist. And so we have a challenge in the country where we don't have enough oncologists. But it doesn't mean we don't call each other and we don't collaborate. We do have meetings once or twice a week where everyone comes together, we discuss cases. And so even though I'm based in Lagos, I help manage patients in Kogi, Kwara, and other places. So you want to be sure that you are getting the best from your team and one person is not treating you from beginning to end. If that is happening, that care is already compromised.
Is it possible
And so
for
I'll
a
encourage you to
pregnant
please go for your
woman?
treatment. Please proceed.
Okay. Is it possible for a pregnant woman who has never smoked before have lung cancer?
It's possible. We've diagnosed quite a number of pregnant women with cancers. And in fact, in our guidelines, like our reference books, where we make our decisions from, there's usually a place in our guidelines. When we diagnose breast cancer in a pregnant woman, this is how to treat. When we diagnose cervical cancer in a woman who wants to give birth, this is how to treat. These things can happen in some instances.
In today's digital age of misinformation, from your perspective, what practical advice would you give patients and the public on how to critically evaluate medical recommendations and distinguish evidence-based guidance from misinformation?
That takes a lot of wisdom. because yes, we have people claiming cures and saying they can cure and they can. What I would recommend is don't go shopping online for healthcare information the way you shop, for clothes or other items. You can use the internet to compare, gather information, do research, and you go to credible websites of hospitals, of NGOs. You have to research. If you have the opportunity to then get multiple opinions, like if you're not satisfied with an information, then go in and see a doctor to clarify. If you're not satisfied, get a second opinion. Second opinion has saved many people's lives, especially in oncology. Sometimes a treatment plan may go this way, but the person providing the treatment plan is not even an oncologist. And then the person is saying, oh, this doctor I've seen, I don't think he's an oncologist. Then they go online and search. So one thing I would say is in Nigeria, we have the NICRAT, which is the National Institute of Cancer Research and Treatment. Please, if someone on my team can just put that in the chat box. If you want to verify information, please, you can go check there. You can also check Pearl Oncology Specialist Hospital. You will find credible information there. And our commitment this year is really to answer questions like this from the specialist perspective. And so for some of the questions we're receiving, we may not be able to answer all of it. Our promise to you is that we would answer all the questions, put it into a video and share it via email and put it on our YouTube. You may have to sift through to look for the answers, but we promise we would definitely answer those questions and post it to you because Nigerians deserve better. People should not be treated because they can't find the right information.
Okay. Thank you very
Ogi
much,
to the
Dr.
world.
Sanako.
See you.
Okay, so we still have about 10 questions. So I think I'll just ask the final one for tonight, and then we'll make a follow-up videos to answer all other questions. So this person said, is there anything like brain cancer?
Yes, sir. Yes, sir. Yes, ma'am. There is brain cancer is common. It's commoner in children, but adults do have it. And some brain cancers are aggressive. Some brain cancers are not very aggressive, and once removed, they do have good outcome. And brain cancer it's relatively common. It's not the top 5. I think it's the 10th or 12th common cancer in Nigeria it occurs. And so I want to encourage everyone to please prioritize healthy habits. I hope you've learned some new things that you will do, not because they are new, but I hope you are encouraged to do new things with the information you've always known and some that you have learned. I hope you're going to book for your screening and your consultation, and you're going to live a healthy life. You're going to choose balanced diet over soft drink. You're going to choose well-cooked meals over fast food, and you're going to spread this word to your loved ones and your network. And should in case you give you a talk further in your network, you can please reach out to us. Thank you very much. Good night, everyone. Thank you for your time. We're grateful.
Thank you very much, Dr. Sanako. Thank you, everyone.